Today we are going to discuss a condition known as foot drop. I'll answer some common questions. What causes foot drop? Is there any test to confirm the diagnosis? Is it reversible? When is surgery necessary? And I'll demonstrate some effective exercises for its recovery. So let's talk about foot drop today. Foot drop, also known as drop foot, is a medical condition where a person experiences difficulty lifting the front part of their foot, causing it to drag or slap on the ground while walking. This condition can significantly affect mobility and balance. The most common causes include 1. Nerve damage. One of the primary causes is damage to the peroneal nerve, often due to injury, compression, or diseases like diabetes. Sometimes the nerves are damaged when they exit the spine. That is called radiculopathy, and nerve roots that affect these muscles are L4 and L5. They can also be caused by a herniated disc or foraminal stenosis. The nerves may also be compressed or damaged when they exit the pelvis or the back of the thigh. The name of this nerve is sciatic nerve. Number 2, muscle disorders. Conditions like muscle dystrophy or Charcot-Marie-Tooth disease can affect the muscles responsible for foot movement. Number 3, spinal cord injury or disease. Trauma or diseases affecting the spinal cord can result in foot drop. One condition that fortunately is very rare now is poliomyelitis. Thanks to the vaccines, we don't see many cases of polio anymore. Number 4, brain disorders. Conditions such as stroke, multiple sclerosis, or cerebral palsy can affect the brain's control over foot movement. If you like this video so far, press this subscribe button and turn on the notifications so you get alerted when I post new videos on this channel. Diagnosing foot drop begins with a comprehensive evaluation by a healthcare provider. To determine the underlying cause and severity of this condition, there are several diagnostic tests that may be used. Number 1 is electromyography or EMG. It's a valuable test that measures the electrical activity of muscles and nerves controlling them. It can help identify if there is any nerve damage and pinpoint its location. Number 2 is the nerve conduction studies. They're often performed alongside EMG and involve the measurement of how quickly electrical impulses travel through nerves. This test can help to identify the extent of the nerve damage and differentiate between various nerve disorders. Watch my other video here about EMG and nerve conduction studies. 3 is ultrasound imaging. It may be used to assess the muscles, the tendons, and nerves in the affected leg. It can also provide some real-time imaging, allowing for a dynamic assessment of the structures involved. Number 4, magnetic resonance imaging or MRI. This is a powerful imaging tool that can provide detailed imaging of the spine, the brain, and the surrounding structures. It can help identify issues such as a herniated disc, a spinal cord abnormality, a brain disorder that might be causing or contributing to the foot drop. Remember, if you or someone you know is experiencing symptoms of foot drop, it's essential to consult with a healthcare professional for a proper diagnosis and personalized treatment plan. This video is not intended to provide you with medical advice. It is for educational purposes only. And if there is an emergency, please call an ambulance or go to the nearest emergency department. The big question many people have is whether foot drop is reversible. The answer varies depending on the underlying cause. In some cases, such as a pinched nerve, rehabilitation and treatment can help improve or even resolve the condition. However, for conditions like muscle dystrophy or severe nerve damage, a full recovery may not be possible. But symptoms can often be managed with the right interventions. I will talk about orthotics later in this video. How long it will take for the nerve to regrow? It is hard to tell, but the results of the EMG and the nerve conduction study will help to estimate that. But if the nerve is pinched around the knee, then the nerve has to regrow a few centimeters. The peripheral nerve grows about 1 millimeter per day. So let's say 3 centimeters will take 30 days. But if the pinched nerve is pinched in the lower back area, to regrow from here to here, it is about 50 centimeters, which is 500 millimeters. So it may take approximately 500 days to regrow. Now, let's talk when surgery might be necessary for foot drop. First is when the nerve compression, the surgery may be recommended if the nerve compression is the cause. The surgeons can release the pressure on the affected nerve to improve the function. Second, we might do tendon transfers. In some cases, tendon transfer surgery may be performed to help compensate for weak or paralyzed muscles, allowing for a better foot control. Now, let's talk about exercises that can aid in the recovery of foot drop. Remember, this exercise should be done under the guidance of a healthcare professional, and individual recommendations may vary for you. You may download the handout for these exercises on my website. Go to www.drandreafurlan.com/foot. The exercises are divided into 3 categories: stretching, balance, and strengthening. Yes, so these are the exercises for foot drop, and you can download this list of all the exercises in my website. I'll put the link to the website in the description of this video below, but then you can take notes of how many repetitions you did every day of the stretching exercises, balance exercises, and strengthening exercises. So we'll follow this routine, and you can do many times a day if you want, or if you want to do once a day. You don't need to do all of them at the same time. Sometimes you can do the stretching exercises if you are in your living room or if you are waiting for someone, and then you can do the balance exercises another time, and then you can do the strengthening exercise another time. But here, just to make it easy for you to remember all the exercises, I prepared this list for you. So in terms of the stretching exercise, what is important to remember is if the muscles of the front of the leg are weak, that's why the person has the foot drop, right? They cannot do this movement. They lost the strength of the muscles here in the front of the leg. But these ones here continue very strong. So the calf muscles, the muscles in the back of your leg, they are very strong. So guess what? There is a tendency of the foot to be in this position because these ones are pulling the foot, the ankle down. And if we don't stretch these muscles, then the person may develop a rigid ankle. So it is important to do stretching, not for the muscles that are weak, but for the muscles that are strong here and they're pulling the ankle down. So how do we stretch the calf muscles? Very easy. You have to pull the calf muscles, you have to pull your foot up. So you can use a bed sheet, you can use even the cane. So for example, if you have a cane, if you're using a cane, you can pull the muscles this way to stretch. You see, I'm stretching these muscles here on the back of my leg. So you pull, pull, pull. You see, the idea is that, you can compare to the other side because the other side doesn't have a foot drop, ideally. So people usually develop foot drop on one side. And you can see how much does my normal foot and ankle bend. So this one. And let's say that the other one is here. So it's not so, it's not the same. So what you have to do is try to bring this one to the normal range and you compare with the other side. So that's simple. You can do this exercise when you are lying in bed, when you are watching TV. You just need to remember to stretch your knee, because if you do this stretch when your knee is bent, what happens is these muscles of the calf, they are shortened. You have to stretch the muscles of the calf first by strengthening your knee, and then you pull the foot up. This is the stretching of the calf muscles that we need to do every day, because if you don't do this, these ones are weak, these ones are strong, they're going to pull your foot down and you're going to develop this ankle will become rigid. And what's the problem is that if this ankle becomes rigid this way, it's really hard to walk. So if there is a peripheral nerve injury, we talked about this, right? The cause of the foot drop is a peripheral nerve that was damaged or injured. So we need to wait until it grows. It grows very slowly. So by the time that it grows and innervates these muscles here, the ankle needs to be flexible and ready to work again. Okay, so that's why it's so important to do stretching exercises for the calf muscles. So now for the balance exercises, again, because this is so important, the person loses balance because their foot is always drop, it's always weak, they can't do this, so they may lose their balance because they don't feel, the muscles are weak. So it's really important to do. If you can go to a physiotherapy clinic, that is the ideal, because there you will be in a safe environment. They usually have parallel bars that you can train walking in a parallel bar, and you have a physiotherapist by your side. That is ideal. But if you don't have access to a physiotherapy and there is no person that can come to your home to do these exercises with you, so what I recommend is that you grab a chair, a very sturdy chair, not with wheels, okay, so very sturdy, that you can hold on here. If you use a cane, you can also grab the cane and keep on the other side so you don't have a poor balance and you may fall. So be careful that when you do these exercises, you're not lose your balance, because we need to train your balance. The purpose is to train your balance. So to train your balance, we do need to challenge your balance a little bit. So how do we do this? Let's pretend that my right foot is the foot drop. So it's like this. I cannot do this movement, okay? So the foot is like this. So what do we have to do to train the balance? Again, it's important because you don't want to fall. We talk about orthotics. I'll explain when orthotics is important, especially if you're going outside. It's always good to wear your orthotics. But when you're not using your orthotics inside of your home and you want to do this exercise, so then you have to remove the orthotics and do this exercise, okay? So what is the balance exercise? We're going to challenge a little bit. So first, stand on one foot, but on your good side. Just so you remember what is to stand on the good side. You try to think about all the muscles that you are activating when you are on one foot. So you see we are activating the muscles in front of our leg, the back of our leg, the sides, because you need to stay in this position. So now, with the foot drop, the side where you have the weakness, you're going to do the same thing, but now you're going to rely more on your hands. So hold here, or hold on someone. If there's someone in your house, grab their hand or their arm. And now you're going to try to do the same thing on the side that has the foot drop. And you're going to notice that because the muscles in front of your leg are not working, there is a poor balance. You're going to lose your balance. But that's why it's important that you train this. And if the more you do this, the easier it will become. Because what your brain will do, your brain will start learning. Your brain will start learning, oh, okay, I have the muscles in my back, I have the muscles on the side, the outside, I have the muscles in the inside. The only ones that are not working are the muscles on the front. So your brain is starting to use the other muscles around your ankle, your leg, to balance and to act for the ones that are not working there, for your balance. And then you can start challenging a little bit. You can go side to side, but if you feel unsteady, if you don't feel safe, don't do this. But you could try to do like a rotating and make sure that you're feeling your muscles. Try to feel your muscles. And when you're doing this, you are sending messages to your brain about the position of your foot. Now, some people because the nerve that is injured also carries sensations from the foot. So it's important that you do balance exercises, because if you also lost the sensation, let's say you cannot feel the top of your foot, or you cannot feel the bottom of your foot for some reason. Usually it's the top of your foot that you cannot feel well, because the same nerves that were lost, especially if it was a peripheral nerve, you're going to lose the sensation on the top of your foot. But if you have a foot drop because of a brain injury, like a stroke or cerebral palsy, you may have lost sensations in many areas of your foot. So this is also important, because if you can't feel your foot, then you have more problems with balance, right? Because if your brain is not receiving sensations from the foot, then it doesn't get all the information. Where is the foot? Like, if I close my eyes right now, I know where my foot is, the position of my foot, because I'm receiving proprioception. That's the name of the sensations. I'm receiving proprioception. I know my joints have sensors, and they are telling my brain the position of my ankle, my bones, my toes, my knee. Now, the person that had a nerve injury, they may have lost the proprioception. So that's why it's also important to train the balance. So remember that. You may do this for a few minutes every day, and then when this starts to get easy, you may start, walking. You may start, practicing going up and down stairs. That's also good without the orthotics. That's what I'm saying. Because with the orthotics, it's easy to do this, because the orthotics basically will keep your foot in this position, and you will not have the foot drop anymore. But what I'm saying is, if you have an opportunity when you are recovering, especially if you're seeing some signs of recovery, the muscles are coming back because they are starting to be reinnervated, or the lesion in your brain is starting to recover, and you can start recovering some movements, it's really important that with some supervision, you do walking without the orthotics, go up and down stairs, because those will be training your balance and your strength. So now for the strengthening exercises, we need to strengthen these muscles in the front of the leg. They are the weak muscles. So how do we do this? And especially it's hard if you don't have any movement to do this. It's going to be hard to strengthen them. But what you can start doing is, again, preparing for when these muscles recover. Most of the foot drop recovers over time. Sometimes they don't recover fully, like 100%. But if it's a peripheral nerve, the nerves regrow and they reinnervate the foot. Or if there is a lesion in the brain will reorganize, and then that muscle will work again. So what you need to do is get ready for that time. Get ready when your brain or the peripheral nerves recover and heal, because those muscles will come back. So how do you do? The first thing is, if you have zero movements, you are unable to do any movement, like nothing, zero. And I know some people get frustrated because they try to do this movement and nothing happens. But what you can start doing is start thinking about that movement. Did you know that the movement starts in our brain? Because every movement that we do with our body starts with the frontal lobe here thinking, planning that movement. So if you start thinking about that movement and imagining that you're doing that, you're already training the brain to do that rehabilitation, that recovery. That's called neuroplasticity. So how do we do this? The first step is, so let's say zero movement on my left foot. Let's say that my foot here is totally dropped, nothing. I am unable to do this movement. What I'll do is I will use the good side to train the bad side. Okay, so this is drop here, but then I will do this movement with my right one, and I will start thinking, how do I do the same thing with my left one? Okay, so imagining that movement, you are making synapses in your brain, you are making synapses to reconnect your brain to those movements. So do this a couple of times, okay? Now, if you have some movement here, let's say that you can do a little bit, even in a flick of movement. Let's say that it's just a little bit like this. Very weak, okay, but you can do it. Now, you have to use that strength that you have to make it stronger, to rehabilitate that foot. It's going to take time. Sometimes it takes weeks, months, or depending on where the injury happened, it may even take a year or more for that muscle to be re-innervated, but don't worry, be patient. So what we need to do is give some resistance to these muscles, because if they move freely, you're not providing resistance, they don't get stronger. So how can you add resistance to these muscles here? You can use, for example, this closed loop resistance elastic bands, like they're closed. I have these ones that they come like a heavy, a lot of resistance. This one is extra light, so you can start with the extra light resistance because this is very easy. And then they progress, you know, from extra light to medium and heavy and then extra heavy. So let's start with the extra light resistance. And who is going to put resistance for you? If you have a partner, someone that can help you to hold on your foot, because what you need to do is someone that will resist you from doing this exercise. Because if you do this exercise freely in the air, there's no resistance, you're not going to strengthen this muscle. So if you don't have a partner, the partner that could put like the hand here and cause some resistance, so someone like put the hand here and you try to move against their hand, that is a possibility. But if you have like a little band like this, you can buy, I'll put the link for this. It's not expensive. I'll put the link for you to order if you want to order those loop bands on a website. And you can use the other foot. So the foot that is good can become your resistance for you. So you hold it here and now you're going to do the resistance. You're going to try to move your foot up against the other one. So you see here, so you can use the other foot, or you can even use your cane. For example, you can put this here on your cane, and here, this might work better. So here, and then you are moving against resistance. So what I recommend is that you do in all directions. So you can move up against the resistance, but also on this side here. So if you put your cane to this side and you move your foot to this side. Let me demonstrate here. I'll turn here. So you need to move your foot to this side and the cane here can hold here. On the other side here. Now we are going to move your foot to the outside. You see here? It's outside, because this movement is also weak. And then you need to put resistance to go up, like this. So that's simple. So when this becomes easy, you can then move to the, let's say, the medium strength elastic band here. The medium one is a little bit harder, right? So it's going to provide more resistance. Again, if you have someone at home that could hold this for you, that's great. If not, you can attach this, let's say, to the chair or to the foot of a chair, the foot of a table, and do this against the table. So here I have more resistance. So I'm trying to pull against this resistance. This is more because this yellow elastic band offers more resistance. But you see I'm doing this here to the outside. Now I'm doing this up, up. And now I'm going to do this to the inside here, because the muscles that are weak in foot drop are the muscles that do, this is called inversion. So this is called inversion movement. Inversion, dorsiflexion, and eversion. Yeah, I know the names are complicated, but inversion means they're going inside. So this side here is inversion, dorsiflexion, eversion. So those are the movements that we need to do strengthening. And the other type of exercise that is really good when you are trying to strengthen these muscles is against the water. So if you are in a pool, if you have access to a lake, a river, a pool, and if you're there and you start doing these exercises in the water also offers resistance. Not a lot, but it offers resistance. So anything that puts resistance here and then you move against resistance will be a strengthening exercise. Now, let's talk about orthotics. Orthotics are specifically designed braces and splints. They play a crucial role in the management of foot drop. These orthotic devices are designed to provide support and improve the function of the foot and ankle. A common type of orthotic used for foot drop is known as ankle-foot orthosis, or AFO. AFOs help control the position of the foot, preventing it from dropping excessively and aiding in a more natural gait during walking. These devices can be customized to fit the individual's specific needs and the level of muscle weakness or paralysis. Orthotics not only enhance mobility, but also reduce the risk of tripping and falling, making them an essential component of the comprehensive approach to addressing foot drop. It is important to consult with a healthcare provider or orthopedic specialist to determine the most suitable orthotic device and receive a proper fitting and guidance on its optimal effectiveness. So, in conclusion, foot drop is a challenging condition that can have a significant impact on a person's life. The key to managing foot drop lies in identifying the underlying cause and pursuing appropriate treatment options, which may include surgery or rehabilitation exercises. Thank you for joining us today, and if you found this video helpful, please don't forget to like, share, and subscribe for more medical education content. Stay healthy and take care. Bye!